हेलो एवरीवन। आई होप यू ऑल आर डूइंग गुड। मेरी तरफ से आप सबको क्रिसमस की हार्दिक शुभकामनाएं। आई विश यू ऑल अ मैरी क्रिसमस। Let's take a PYQ topic. A pregnant female detected with 16 weeks fibroid in pregnancy. And now, along with the fibroid, the patient is also complaining of bleeding and pain. They've asked us what is the treatment. So here the key word in this whole question is fibroid in pregnancy. So let's study what is degeneration of the fibroid. The blood supply of the fibroid comes from its periphery and goes toward the center. If the fibroid is big in size, then its center of the fibroid will not receive the blood supply, because more the fibroid becomes big in size, the center will be deprived of the blood. So the central part will start degenerating. Okay, the central part will start degenerating. So what is the most common degeneration? The most common degeneration is hyaline. The fibrous tissue of the fibroid will change into hyaline due to the lack of the blood supply. Right. Now, what happens to this fibroid in pregnancy? The degeneration which typically occurs in the pregnancy is known as red degeneration or carneous degeneration. Let's see what it is. Now, all these highlighted areas are the PYQs which are asked in the previous exam. In the second trimester, as we have studied, that amniotic fluid, it start becoming significant due to the increased urine. Right. So now in the second trimester, the bigger size of the gravid uterus, it compresses the blood supply of the fibroid, and there is thrombosis in the fibroid. Okay. Typically occurs in the second trimester. Okay. On the second trimester also they have asked the PYQ. In the pregnancy, in the second trimester, when the pregnancy mass, the uterus mass increases in size due to the significant amniotic fluid. The blood vessels, they are compressed by the gravid uterus, and there occurs thrombosis. And due to this thrombosis, the fibroid becomes red in color or carneous, and there is now red degeneration occurring in the fibroid. Due to this thrombosis and redness, there is a reactionary inflammation, and the whole fibroid, it becomes red. Okay. Now, what happens to the patient? The patient suffers from pain, fever, and mild leukocytosis. Please remember, it is a leukocytosis, but it is a mild leukocytosis. Here you have not to do anything. You have to just give the conservative treatment. Let me remind you, the patient is pregnant. If you try to give the surgical treatment, myomectomy, then you will land up in MTP, and there is no need of doing the myomectomy. So you have to only give the conservative treatment. After some days, the compression of the blood vessel will go, and all the symptoms, they will be healed. Okay. Now, what is conservative treatment? By conservative treatment, I mean that as patient was having pain, mild fever, so I will give paracetamol and IV fluid to subside the pain and fever. So by conservative treatment, I means I will not give this surgery, but I will give the paracetamol and IV fluids. Let's see the question what they have asked and what the options are. The options were hysterectomy. Hysterectomy cannot be done in a pregnant patient, and especially for a thing which will get healed in a few time gap, right? Again, we will not do myomectomy, because myomectomy is, when we will be doing myomectomy in a pregnant uterus, we will end up in MTP. No, MTP should not be done for a thing which will be healed in a few gap of time. Yes, conservative treatment. We will give injection paracetamol, IV fluids to the patient, so that patient can tolerate the pain till the things get recovered. Okay. Thank you. I hope you find all this information valuable, and Please do subscribe, like, and comment my